afternoon, everybody. I'm Jody Hanson. I'm the Director of Public Affairs and Communication for Johnson County Government. Thanks for being with us today. We have Dr. Sami Ariola, who is the Director of Johnson County Department of Health and Environment. We also have Elizabeth Holshoe, who is our Director of Epidemiology. And then we have Allison, who was our ASL interpreter today. Thanks for being here with us today. Dr. Ariola, maybe you could start by talking a little bit about the plans for this week at the vaccination clinics.
Thank you, Jody. Good afternoon, everyone. This week, we are basically going to continue what we started last week, which is a special focus on our residents that are 65 or older. All of our clinics, Tuesday through Friday, geared towards that. We opened up several thousand appointments, and so did, by the way, partners in our health systems. I've spoken with several of them today. They have appointments that are open. If you are 65 plus in our county, now is a good time. We still have some appointments open, as well as our health systems. The ones that I spoke with today have appointments open. So that's going on. All of our clinics this week will be at the Oakland Field House, and the time is 9 to 1. And so if you have an appointment, we ask that you show up. Again, if you don't have an appointment, you still have an opportunity to be vaccinated. And now, moving forward beyond this week, 65 plus will continue to be a priority, but we are also vaccinating like we've done in other very important groups. Elizabeth, as always, will provide an update on where we are vaccinating in our educator and childcare establishment category, which again, she's got some great news on that end. We are beginning last Friday. We vaccinated, working with our partners, Health Partnership Clinic, vaccinated some of our homeless population at Project 1020. And there are clinics planned with Salvation Army and Olathe Health on March 11th and 13th that are vaccinating in this population also, and our other population that are in shelters across the county. We started last week working with Josh Powers and our partner in the transit department, transporting our residents who need assistance to get to our clinics. I believe we did about 20 of those last week, and those will continue this week. And we have been working very hard on vaccinating and taking vaccines to some of our residents that are homebound. Those are starting this week also. So a lot of good news that are starting this week. We are working with, we started working several weeks ago with JCDS and other partners that caters to the needs of intellectual and developmental disability group. Very happy that they're working with a third-party pharmacy that we're able to provide vaccines to. That is expected to start this week. We are working with UCS and several other partners on several other vaccination. I know that apart from the clinics that Advent Health put together, they are working with us also on reaching out to our minority populations in the county. We are beginning to work on the finalizing details about vaccination in our correction facilities, both with the younger population and the adult population. We are just working to address all of the different parts of phase 2. We are working to get our grocery store workers and restaurant workers vaccinated. We're going to provide those details very soon, but all of those are in the works. So again, lots of work going on, trying to bridge all of the gaps that we have. But as always, Jody, let's hear the good news from Elizabeth. Personally, I'm excited at the fact that our schools are open, and we have poured resources into that for for the past 1 year. And I think we're all very excited to see where we're. Elizabeth.
Thank you, Dr. Ariola. Yes, tomorrow, Tuesday, is actually going to be our very last first dose clinic for all K through 12 and care providers who are interested in the vaccine. So we're very excited. We have been, and by we, I mean Johnson County Children's Mercy Hospital, who's providing all of the staffing for vaccinating our educators and our childcare providers, as well as our public school districts, our private schools, and our childcare providers have all really been in this, to Dr. Ariel's point, for the past year. And in particular, you know, our childcare providers stayed open during the stay-at-home orders, or many of them did. Our schools have really been having to be pushed and learn and navigating this whole world like we are as well, and all of our residents. And so at this point, we are coming to sort of the culmination of a lot of work, particularly over the last month, to try and get them all vaccinated. And so we will hopefully be having final numbers about the number of individuals who have taken the vaccine, what percentage that looked like. But either way, as of tomorrow, anybody who was interested in receiving the COVID vaccine who falls in that group has had the opportunity to receive it. And so it's very exciting. And then over the next 3 weeks, we'll be finishing up all of their second doses. And so it looks like really by April 1, we will not only have first doses completed, but also second doses for this group of what I think will turn out to be about 15,000 individuals, maybe a little less, who decided to take the vaccine. So if you recall, even a couple of weeks ago, we thought that we would still be doing first dose clinics into April. And then thankfully, Governor Kelly had decided to start allocating additional vaccines separately from our county allocations just for the K through 12 educators, which really allowed us to move through that group much quicker than we anticipated, really at twice the rate. And so again, a huge thank you to all the partners who have allowed this to happen. Again, Children's Mercy Hospital, a number of our public school districts have provided locations for us to do these vaccine clinics, both Olathe, Lee Valley, and Shawnee Mission. And then just all the partners who have gotten their staff in, allow their staff to take some time potentially to get into these clinics. So just very exciting for us and for everybody involved.
And Judy, I want to reiterate and also to reiterate and underscore that special shout out to Children's Mercy Hospital. They have been a terrific partner, as are all of our school districts who have worked with us throughout this process. I want to say one or two more things before your questions, Jody, about the 65 plus category. So what we have done the past 1 week is open up a lot of appointments in that age group, and we're going down our list. Up until this morning, we had sent those appointments to 20,000 residents. This morning, we sent it to another 5,000. And in communicating with partners who also have vaccines and appointments this week, there are open appointments there. Our call centers are assisting people in booking appointments. And we know how many of our residents are 65 plus. Like we've said, that's over 95,000 of us in that category. So we do know that there are pockets of people that have not been vaccinated yet in that group. So if your dad, your uncle, friend is 65 plus, we have appointments for them. Even if it's not this week, we'll continue to have appointments for them. If call us, we'll walk them in. So lack of appointment is no longer the reason. Right now is the time, this time we have a lot of appointments with us and with our partners right now. And like I've said, we've spoken with our partners. Please understand, to the extent to which you can explain it to your friends and to your parents, we now have 3 vaccines in the market. All 3 are very safe, and all 3 are very effective in protecting us against the vaccine. All 3 are shown to be 100% effective in preventing death and hospitalization, as well as severe illnesses. And we have local data, and Elizabeth can jump in and talk about that to prove that. A few weeks ago, we had 49 outbreaks in our long-term care facilities. Right now, we're down to 1. Maybe you're even close to that number being 0, Elizabeth.
You know, I was actually just about to go look at that. It was close. If they're not off yet, they will be this week. which is just really incredible to think about the effect of this vaccine, as well as, our decrease in community transmission. So we are 27 days since this last facility's onset date, which means one more day and we will have no more long-term care facilities with an active outbreak in Johnson County, which is truly like the first time since, April? that happened of last year. So it's really, and so much of this is because of the vaccine, which is incredible to see.
Yeah, and across the world, over 100 million people have taken these vaccines. In the United States, it's over 80 million. It is safe. We have the data. And so it's one way that we are able to quickly get back into life like we know it. We are in public health. We are cautiously optimistic. Of course, we are cautious. We know that the trajectory can change, but we also know that the vaccine has been impactful, and we expect the impact to continue to be positive moving forward. And so again, if you are 65 plus, based on the data, not just here, but across the country, you do have, your risk is slightly elevated compared to people that are younger, especially if you have comorbid or other pre-existing conditions that are associated with some of the more serious consequences of infections of this virus. So again, we are asking you, if you have questions, we're very happy to answer those. You can email us, jcdhe@jocogov.org, or you can call us 913-715-2819. We have the vaccines. We have spots for you, a ton of spots this week, but even if you don't get in this week, anytime that you reach out to us, we'll book a spot for you. I wanted to just make sure that all of our older residents, 65 plus, that you understand that you will continue to be priority. Now is a very good time to get vaccinated. But if you don't have time this week, reach out to us. We'll walk you in the next week or the next week. You continue to be our priority. Thank you.
And would you say that calling or emailing would be the good next step for somebody maybe that's 65 and older that either didn't take the interest survey or did, but maybe never saw the email or it went into their spam? So there's people that are 65 and older and they're eligible. They just don't have that link that would have come to them in the email. Or if I wanted to tell a neighbor about it, should they call or email to make an appointment, or what should they do?
Right. So we are getting tons of calls every day. So I hesitate to say that, but for this age category, call us, email us if it's difficult for you to complete the online thing. But Jody, also, so you know, we have several partners in the community that are calling people and assisting them with booking their appointments. The link is out there. So for those people, you can get an appointment for your friend, for your uncle, for your aunt, for your grandparents. That link is there, and we have the appointment now. We're getting a ton of call, and that's probably what I shouldn't say, but because this is our priority group, I want to get them in. Call center, people that are taking our calls are aware, and they're assisting people in booking appointments.
Yeah, I will just jump in here, maybe save our call center a little bit. Right now, I just pulled the numbers as we were jumping on. We have 53 open appointments for this week. So we're really dwindling down out of our 5,000 open appointments. So we are starting to max out where we are this week for JCDHE. And I also know that we have about 25,000 people who had filled out the survey that we still have not emailed. Although a number of those we know have been able to get the vaccine through our healthcare partners. And also don't forget the pharmacy partners as well, who are immunizing those 65 and up. So if you are looking for your friend or your neighbor, certainly look at our pharmacies in Johnson County to see whether or not they have any openings as well. So there are a number of opportunities. At this point, Johnson County is nearly full with at least what we have allocated so far. But certainly, I think that really in the next few weeks, we should see really moving through this population pretty quickly.
And that's pretty good. When we checked this morning, we still had over 600 spots. So that's good that you are taking up those spots. I would tell you again that several of our partners have spots that are available. Call them. And there's still a possibility that we have more spots open up. So that's very good news, Elizabeth, for that update that's down to 50. That's fantastic. Yeah.
And you can go to jocogov.org/COVID-19-vaccine. And you can access the interest survey if you still want to take that. You can get a list of healthcare systems and pharmacies that you can check out and check out their website, see if there's an opportunity there. So good information on the website. So thank you for those updates, both of you. I think we'll go ahead and take a couple questions if that's okay. Somebody wants to know they got their first Moderna shot out of town. They can't go back to where they received it. They're due March 13th. What can they do? And I know we tell people you're supposed to get your second dose where you got your first dose, but this is sort of a very specific example. What would we tell this person?
Yeah, thank you for the question. We have received a lot of those. If you got your first shot anywhere in Kansas, please call them, make arrangements to go there and get vaccinated. Here's how these things work. They ship us exactly the exact amount of the second dose equal to the amount of the first dose that were sent. So if we have too many second dose requests that are not part of those that we give the first dose, you really throw our allocation out of balance. And so while we might be able to accommodate some, that is the best way is to reach out to where you got your first dose. So if you have second dose due on the 13th, we will be interested in where you got your first dose from and why you are unable to get your second dose from there. And if it's a local institution, we're very happy to contact them and try to understand why not. Still, our best advice is get your second dose where you got the first dose from.
Great, thank you. Somebody wants to know why are some of the pharmacies limiting their vaccines to 65 plus and teachers, and some have moved on and they're starting to vaccinate grocery store and food service workers. They were concerned about that.
I'll try, and Elizabeth, please jump in. The pharmacists are not getting their vaccines through us. They're getting their vaccines directly from the federal government, and they are following the instructions that they are given. I know that the instruction is that they do what the state is doing. So if they are vaccinating 65 plus, that's because that's the instruction that they are giving. If they are doing educators, that's part of phase 2. That's what they're doing. If they are venturing into grocery store, that's also part of phase 2. And if you look at all three, those are actually part of our phase 2 tier 1. And like I said earlier, we are finalizing plans to expand vaccination in grocery store workers and the rest of phase 2, and we'll be sharing those. But that's the instruction that the pharmacists are giving, and I suspect as more vaccines become available and we move to other phases, they will be making the same adjustment moving forward.
Yeah, I think from what I'm aware of is that Kansas is one of the few states that has told their pharmacy partners they must vaccinate within a very narrow group. So, and as far as I'm aware right now, that is only 65 and older and K through 12 educators. And I believe that is what is set for all Kansas pharmacies. I do know, at least anecdotally, that there are pharmacies in, say, Missouri that are vaccinating individuals from other categories. So I think from my perspective, I'd be interested to know if these were just Kansas or Johnson County pharmacies, or if you were talking about Missouri, because those are being dictated by different groups as to who's allowed to be vaccinated in each.
Okay, thank you. Someone showed some concern about certain people that can't get vaccinated yet, as far as people that have health issues, maybe comorbidity issues, or I saw something about BMI, but really that is the state that is deciding those phases, correct? I don't know if you wanted to kind of clarify what our piece is of that.
Yeah, I'll start and then I will let Elizabeth talk about our plans moving forward. So we did not determine what categories fall in phase 1, 2, 3, 4, or 5. Those decisions were made by the state. We, of course, have the prerogative to prioritize within each of the phases. Now, the way that this is set up for those that are 16 to 64 with existing conditions, I believe the severe critical ones or serious ones are in phase 2. And examples of that you can see online in the document that we have on our website as well as the state's website. And phase 4 are going to be the same age group, but milder ones. But question is, we don't make those decisions. However, we are going to be clarifying to the extent to which we can. I do want to remind people that our goal is to vaccinate all of our residents. And the only reason that we are prioritizing is because we just don't have enough vaccine. So you want the vaccine, we want to give you the vaccine. So we're not trying to create obstacles for you at all. We're trying, on the contrary, we're trying to make it easier for you to get vaccinated. And as we get more vaccines, those categories become even less important because we just want to vaccinate you. So, but Elizabeth, I'd like for you to talk about our plans for phase 3, 4, and 5, and so that I think the questions are coming because people want to know. Obviously, we don't make the call as to when we move to the next phase. The state does, but we're already planning for that, aren't we?
Yes, we absolutely are. As we continue to move through the 65 and up age category, this is our largest phase group that we have. And then you combine that with the fact that we're also talking about educators in that same phase and tier. We expect that once we can get through phase 2, tier 1 in Johnson County, we should be able to move through the additional tiers pretty quickly and be prepared when Governor Kelly hopefully announces that move to phase 3. So we want to be ready to open up our vaccine clinics for those of you who are eligible and for phase 3. So for the most part, those are going to be individuals age 16 to 64 with certain pre-existing conditions and then some other high risk sectors. And so in order to aid in our understanding of how many of you are in each of these groups and who are interested in receiving the vaccine, we've developed another survey and we expect for that survey to hopefully go out early this week. And really it's going to be the same as our phase 2, except for those of you who are in subsequent phases to express your interest in receiving the vaccine. Let us know either what your conditions are, if you fall in one of these groups, so that we know when we move into this next phase, how many individuals we have to vaccinate and have a way to reach out to you. So stay tuned on these. This will probably be where we announce it, that we have this new survey out and we are working to get that out as quickly as possible.
Great. That's a good update for people to watch for. Another question, if somebody loses their vaccination card, that record card, does it need to be replaced? And if so, how would one do that?
I think our staff, if you got your vaccination from us, I think our staff, even though we don't want to be doing too many of that at the clinic because it takes a while, but we do have a record of your vaccination and we're able to confirm when you got it and when your second dose is due. Again, we're getting hundreds of calls every day. So I know if I put out the number again, Elizabeth will jump in. So I'm not going to put out the number, but keep your card. But we do have resources in place to help you verify when you got your first shot, when the second shot is due.
Will say that, yeah, you really want to try and put that card in a very safe space, not only for your own record keeping, but certainly, if you're traveling, there may be, especially internationally, there may be a need to show that card, and so just keeping that in a safe space that you have access to is going to be pretty important, maybe with your social security card or your passport or something like that.
Okay, good advice. Thank you. We've got a few minutes left, and we had a question on here that I thought maybe we could spend a few minutes on about the new guidelines that the CDC released today for fully vaccinated individuals. And somebody watching today just wanted some clarification about, it says, the CDC released guidelines for fully vaccinated individuals dining out with others, along with being unvaccinated, unmasked individuals. Can't they be carriers of the virus even if they're asymptomatic? I think overall they're just looking for some clarification on that guidance that came out today.
So we will say one or two things, but we are yet to get very deep into looking at the document. It's been, of course, you can imagine what our days look like, but Dr. Lumasta did talk about some of that in this morning in terms of look, the CDC document, the highlights that I personally have seen is pretty consistent in ensuring that people understand the risk that's out there, and they need to continue to take all the necessary steps to wear masks and to physically distance. Again, like we have been trying to do locally with the vaccine, is trying to make common sense decisions in terms of rolling things back and letting us get back to life the way we know it, to be able to socialize within reason. And so one of some of the languages that you see there is, if you are interacting with, again, it's not uncontrolled interactions. It's talking about maybe one or two families there, but it's talking about a fully vaccinated person, perhaps somebody that's yet to be vaccinated, but with much lower risk of the serious consequences. So if I was 70, I'm not taking that risk. If I have pre-existing conditions that is consistent with this, I'm not taking that risk. I think bottom line for us is how do we balance the message? The numbers are down, but we know in our field that that could change very quickly. We know enough about the virus. We're concerned about the variants that are coming in. At least the first two vaccines that we got were not tested against these new variants. There are preliminary suggestions coming out of certain parts of the world where certain variants there are infecting even people that have been vaccinated. And so there's just a lot of concerns that are there, and there's nothing that the prudent decisions to do is to be very careful. The CDC director last week was still very clear about places that are rolling things back. And so I would not recommend, if you have a family, obviously that are also diligently following these basic procedures and protecting themselves, yes, you might begin to take some baby steps. Obviously, for me, if I was going to go and see my 83-year-old mom in Chicago area, I will make sure that I'm wearing mask. I make sure she's wearing mask. I'll make sure she's protected. My point is be careful. It's got to be gradual. It's got to be done safely. And all of the steps that we're saying continues to be important, even as we try to get more people vaccinated.
Yeah, and I'll just follow a little bit. I think, look, we're 1 year and 1 day from the very first case of COVID-19 in Johnson County. And we're only about 15 months out from having discovered this virus. And these vaccines are fairly new. And while we know that they're very safe and they are very effective against severe illness and hospitalization and death, there are still some questions like, how certain are we that if I'm vaccinated and I'm showing no symptoms, but I've been exposed, can I still spread the disease? And so I think that that's really what CDC is looking at, is how do you balance, to Dr. Ariola's point, how do you balance what we know and what we don't know? And so, yeah, CDC's guidance is sort of this cautious, but I think appropriately so, where if two people are vaccinated, then they can be together unmasked. But they're still not recommending even medium or large size gatherings. If you are gathering with people, still keep it small and preferably have both parties vaccinated, and you can meet and be around each other without the masks. However, there is still a risk. So continue to do things. If you are going to meet with somebody, have the window open or go outside. It's a beautiful, beautiful finally. So, it's not time to fling everything open, but certainly the vaccination increase, our case rates dropping, the CDC guidance, I think today really helps hopefully clear some things up. And Dr. Ariola and I will dig into that literature, probably as bedtime reading, because that's what we do in public health. So stay tuned for some additional information. But I think that it's a good step in the right direction as we are increasing vaccinations throughout our community.
Sounds good. Do either of you have any closing remarks before we wrap up for today?
We, like Elizabeth said, we are going to be getting into more details of the CDC guidance in the coming days. And we are also going to continue to update you on vaccination appointments. 65 plus continues to be a priority. The depending on how many vaccines we have this week. So it is possible that even us, we make additional appointments available. But right now we have pushed what we have, for lack of a better word, to close to the limit of what we expect this week. But we will continue to evaluate that. But also keep in mind that even if by the way, I'm very excited. This morning, again, we had several hundreds appointments open. And Elizabeth, who checks the data real time, even while we're here, is saying that that's very good news. And there are other things that we look at with the data and uptake, how many people will send it to, how quickly the positions fill up. But there's no question across our system that is slowing down. And that's why the message to you is, if you're 65 plus or know somebody who is, get them registered. We know how many of our residents are in that age group. There's still several thousand that needs to be vaccinated. And so that messaging is also as important as you booking the appointment. Thank you.
Well, great. Thanks to both of you for the update today. Good information. Allison, thanks to you so much for being here as our ASL interpreter. And thanks to everybody watching on Facebook and asking your questions. We will continue to talk about this topic as long as people are interested, which I think is going to be a while. So thanks so much for being here, everybody, and enjoy the rest of your day.